welcome to Medical Dialogues show. I am Dr. Nandita Mohan, and today I will be talking to you all about a revered figure in the realm of humanitarian service and healthcare innovation, Dr. C. Sreenivas, who is the chairman of the Sri Sathya Sai Health and Education Trust. Throughout his distinguished career spanning over a period of 4 decades, Dr. Sreenivas has exemplified an unwavering commitment to the principles of Bhagwan Sri Sathya Sai Baba, devoting his life to spearheading a myriad of service projects encompassing healthcare, education, drinking water supply, and even rural development. Under his visionary leadership, the Sri Sathya Sai Sanjeevani hospitals have risen as symbols of hope, providing extensive pediatric cardiac care services entirely free of cost, reflecting Dr. Sreenivas's unwavering dedication to serving the underprivileged. So, welcome to Medical Dialogue, sir. It's really a privilege to be interviewing you here today.
Thank you. Thank you for that kind introduction, Nandita. So please go ahead.
So finally, sir, it's actually a pleasure to be having you on board here with us. If you could just share with us the inspiration behind initiating the program to actually provide comprehensive pediatric cardiac care services that you are providing completely free of charge. And also, if you can tell us what motivated you to actually dedicate your efforts and all these specifically confining to pediatric surgery.
As you mentioned in the introduction, I represent the Sri Sathya Sai Health and Education Trust, which is a public charitable trust founded in 1970. It was founded by Bhagwan Sri Sathya Sai Baba with the singular purpose of providing healthcare and rural services totally free of cost. I would want you to note that the charity was founded fundamentally on the principle of providing all services totally free of cost. This was because this was at a rural location, and it was primarily in an area where there were many war veterans and war personnel who had settled down. And at that point, the only way to do service was to provide it free of cost, because that was the right thing to do. And Bhagwan, being a figure who had served humanity and predominantly much of the needs within our country, this was the way we began. Later, it was my good fortune that my revered mother, Dr. C. Rajeshwari, was beckoned by Baba to come and set up the first totally free of cost general hospital in then Whitefield. So the journey began then, and post Baba's passing and Samadhi in April 2011, it was revered Madhusudan Sai guidance to me that we should renew and continue with greater vigor the service of the citizens and the population, both of our country and the rest of the unserved world. At that point, I had a good friend in Sri Keshav Desiraju, who was Secretary, Ministry of Health, Government of India. It was my fortune to have his friendship and association, and having known him, we discussed as to what would be the right direction to take to create institutions of service for the nation. So it was his direction that the investment our country needs to make is to be in children, because the need for child care or child health care, predominantly in the rural, tribal and vast unserved geographies of our country, needed greater impetus and energy. And as the direction received was to commence the first center in Chhattisgarh, it all the more made sense because at that point in 2011, Chhattisgarh was certainly not amongst the most well-served states of our country. And as a divine ordain, I went there, and also counsel was received from a revered good friend, Dr. M.S. Valyuthan, who I had the pleasure of knowing for several decades. He very strongly endorsed the view that the need of the country was an investment into child health. So that certainly renewed and reiterated what was conveyed, and that was how we forayed into child health. At that point, Nandita, I was told that congenital heart defects were amongst the commonest of defects for newborns in India. This was a written document given to me by, again, the Ministry of Health, and it naturally necessitated creating an institution of child heart care. What was different here was that setting up an institution in Chhattisgarh which had to be the best in its class, and accounting for the best equipping and as well as the best medical personnel you could get in the specialization, was undoubtedly the first task to be taken up. Also, an investment was rightly made into screening, detection, and understanding the profile of rural children. I think that was something which always has been very close to our heart, which gave me opportunities to move into vast unserved geographies of the country. Now, that brought about tremendous learning of the vast inequities that we are all very familiar with, because as you're aware that we live in a country where there is enormous progress of over medicalization in certain areas, but there are very vast geographies which still need to be addressed, and the penetration of an equitable healthcare into these vast geographies is always a matter of challenge, and enormous will is necessary to take what I call class care to the mass. And this was the reason how child heart care and child health became our major investment, and this was how we began. Yes, today it is over 12 years, and to give you what was told to me, that at a point where everybody from the states of central India would go to Bombay, to Bangalore, to Delhi, or to Chennai, today it is a matter of some distinction for all of us as Indians that we see the highest convergence of children with heart disease to a place of called Naya Raipur in Chhattisgarh, and I think our work speaks for itself in what we have done thus far.
Very true, very commendable work that is definitely being scripted, and it is very well known to all the amount of effort that you've put into this program. Now, sir, if you could just highlight on, you just mentioned that you established your center recently in Chhattisgarh, the first center that was pediatric care center that was established. So if you could just enlighten us on how has the program actually evolved after its inception.
So when you come from a public charity, Nandita, into the space of healthcare, first your whole approach is unique in many ways, because you take this as a cause, as a purpose of your life that you wish to serve. And that is the differential, there are multiple ways of addressing a problem. And the way one addressed this was, when you treat and handle children, the first thought came was every family invests in its children. That was a thought which came very uppermost to us, because children, as it is said, are the investment that we make into a country's future. And taking that cue, I believed that what is the natural entitlement as a human birth? The best must be done for the children, irrespective of wherever they come from or whichever denomination or class they belong to. And wanting to do something unique, I thought in terms of creating a model, we designed our hospital first in the shape of a heart. Now, this is just a thought because you can make a building which eventually becomes a hospital. But when you want to represent a cause which will stand out as a singular identity of who you are in terms of also what you do, I thought the most resonating way is to create an edifice that represents the heart, which is a child heart hospital in the shape of a heart shaped building. Now, that has become, in a way, an identity and almost an icon of us that all our centers are in the shape of a heart. And from that, the modeling was that uh, there should never ever be a percentage of compromise in what is done, irrespective of where you are located. You could be sitting in the most advanced center of the world, and I did not ever see a reason why the same, if not attempting and aspiring to do something even better, should be the way you do it. And that was where we were blessed to get some of the finest medical teams to come and serve there. A lot of credit, of course, to the blessings of Baba, who certainly inspired and enabled that to happen, and the model which stood by providing care totally free of cost. Now, the model of standing on a institution which provides totally free of cost is certainly what would appear to be challenging. But to my view, there was no other way, because most of the families whose children were afflicted with heart disease sadly came from the poorest and the most disadvantaged sections of society. Now, there was just no way that economics could be worked out that they could find their money to pay for these kind of treatment or surgeries. So the right and the only choice that was left in front of you was to serve them and serve them free of cost. And being from a public charity, that's the way we work, and by mandate, we were expected to do that. Remarkably, the acceptance of this model and the participation, support, and the endorsement of multiple segments of society was most heartwarming and reinforced the faith that we have in society, community, and the nation. Because anybody would relate to a child who's dying in front of a hospital gate. And the numbers that we see in our hospitals are enormous and extremely large, and they come from every part of the country. So that was how we embarked on this journey. And of course, we managed to scale uh, pretty fast given the geographies that we are in, and given the highly specialized and complex surgical procedures that pediatric cardiac surgery entails. I would give immense credit and salutation to my teams for the remarkable work that they do. This primarily comes because when the model is a model of selfless service, and if I might dare say, when the example is set by people like us in the trust who serve totally free of cost. As you would be aware, we are all honorary members of the trust, and that's how it is expected to be. I think it becomes an example that is emulatable by the teams here. And I would repeat that the faith and trust that Sanjeevani has built in healthcare and in the communities that we serve is something which is extremely heartwarming. As you are aware, the foundation of healthcare is faith and trust. Today, hundreds and thousands of families converge to our institutions primarily because of trust and faith in the system that the best will be done for them, and it will be most sincerely and compassionately done for them. And of course, it's done totally free of cost.
Great, that's a wonderful journey that you've embarked on, sir. Definitely, you definitely have a long way to go, and all the best wishes. That is definitely all your way. So now you also mentioned about some challenges that you had faced. So if you could just highlight on those challenges that was seen by you or experienced in providing these life-saving, free of cost pediatric surgeries, and how did you overcome them?
See, Nandita, when you wish to serve the unserved and reach the unreached, which is our motto, you're obviously going into terrains and geographies which have very little in terms of human resource or even medical infrastructure or even accesses for people to come. But I reckon that's the only way you can make healthcare a level playing field in our vast country. Because if you confine yourselves to otherwise served areas, I don't think you're making a real difference and reaching the unreached, as I would say. So certainly, when you commence and go to areas, the next center came up beyond Vallabhgarh, as where I'm sitting right now. Certainly in Haryana, I'm now in a district called Palwal, which at its time when we commenced was amongst the aspirational districts of our country. And the natural migration from Palwal was to go to Delhi. But today, with my hand on my heart, I can tell you that there are doctors from Delhi who migrate to Palwal. Now, that is a testament to what is being done in Sanjeevani. One is the volumes that are being served, the variety of work that we see, and of course, the enormous geography that these centers are today covering, a lot of credit again to the teams that serve here to be doing something like 25 open heart procedures every day is, I think, a testament to what India can do. And this is how we have managed to overcome the word you use, challenge. But see, when you embark on journeys which are wishing to make differences, you have to be prepared for these kind of events and eventualities. But then I guess the fulfillment, the joy, and the immense happiness that you derive when you bring life to those parents who travel thousands of kilometers to you, I think is incomparable to whatever challenge you think you have faced. And to me, that has been the source of inspiration, strength, and hope in our journey. Well, what concerns us is the humongous numbers that are now converging. We get requests from several governments of several developing countries that are pending with us. We have become a training model for countries overseas. So, what began as a model of institution of service today, I might dare say, is a national developmental institute today. We are contributing to the nation in terms of serving children. And when you do this free of cost, Nandita, you're sowing the seeds of goodness and gratitude in them. And what is most heartening is these children are growing up into meaningful, contributory citizens. I think that is where the investment is paying back to the nation. So a challenge there was worth every bit of it. And having done what we've done in these 12 years, I think we've given the nation citizens and children who are not just healthy, but more importantly, who want to give back because they have received the gift of life by a society that cared for them.
Great, great. Sir, if you can just share some success stories or any memorable experiences from your journey so far, if you could just highlight that.
Now, every child saved is a success story for the family, the community that it comes from. And you would agree that there can be nothing more precious and priceless you can give back to a family than the gift of its child's life. But yes, in terms of what has been extremely heartwarming, I would have to begin with the vast number of children of the Indian Army, the Indian Defence Forces, the border security force, the CRPF, and all the police forces of multiple states of our country. Now, this is something that always warms your heart because uh, many times, you come across soldiers who say that, they are working and serving the nation in Kargil, or they're at the Indo-Pak border, or at the Indo-China border, or in the deep jungles of Dantewada in Bastar, or in Gadchiroli in Maharashtra, facing militancy or Naxalism there. And when they come and tell you that they are so grateful that an institution has taken care of their only child, nothing can be more noble, laudable, and nation serving than saving the life of an Indian Army personnel. And yes, I was surprised when I received uh, an information that the wife of the chief of army staff wished to come and meet me in Raipur. So she did come with a delegation of close to 100 people, and she brought with her a small commendation. And then, what touched everybody was that I believe we had served hundreds of children of the forces, the like of which I just mentioned to you. And I think that is something which will forever be a great testimony to what Sanjeevani is doing, because to that Jawan who is standing at 17,000 feet in snow, protecting the borders of our country, if to that Jawan we have brought meaning, purpose, and joy to his life, I think we all as Indians would be proud at serving children with heart disease in the country, and they certainly stand out. And Nandita, I'll also like to point out a program which was brought to me by the government of Chhattisgarh. You might be aware that sadly the state of Chhattisgarh in the regions of Bastar has a problem in the form of Naxalism. So there is a program wherein girl children from these sadly afflicted areas need to make a life for themselves. It is a proud moment for us that over 300 such girls from these areas today serve in Sathya Sai Sanjeevani centers. They work in our operating rooms, they work in our ICUs, they work in every part of the hospital. And to have given meaning, purpose, and wings to fly to these young girls who have never seen a pair of shoes, who've never sat in a bus, who've never seen a railway train, and who come from geographies where many of us would dread to go, I think is something most remarkable. And that, I would say, is what we mean by serving the unserved. You bring so many of our vast populations into mainstream life and give them meaning and hope. And since they are children who have been denied opportunity, they are hungry, and what they turn out to be is something. It's just incredible, See, because when your life depends on it, you're not working for a job, you're not working for a career. I mean, your life depends on it, and suddenly you're working for a cause, for a purpose. And I think discovering life's purpose is what Sanjeevani's mission is. And that is what we do when we save lives. The motto, Nandita, now we are following is not just saving lives, but changing lives. I think life changing and life transformation is what Sathya Sai Sanjeevani has been all about.
Great, that's a wonderful motto, sir. Definitely, life changes. Changing lives is definitely what one should look into rather than saving one. Savings anybody can do, but what changes the life brings after you save them, that is what brings you the actual meaning into it. So now, sir, looking ahead, if you could just explain to us what are your aspirations and goals for the future of this initiative, and how do you plan in continuing to make a difference, confining to the lives of pediatric patients?
Yes. So, continuing from the model of serving the unserved and reaching the unreached, Today we are in the child heart care space. We have centers in Nawa Raipur in Chhattisgarh, outside of Ballabgarh on the way to Palwal in Haryana, then in Kharghar at the invitation of Government of Maharashtra in Navi Mumbai. The fourth one at the invitation of Government of Telangana in Siddipet district outside of Hyderabad. Nandita, we've also, as a derivative, moved into another era and area of much needed intervention, which is mother and child health. Because we came across large geographies and young adolescent girls and young mothers who sadly were not being able to be properly cared for in the maternal space and enable proper and healthy birthing. So congenital defects, as you know, come out from mothers, and so it became a natural process for us to move into mother and child care. So today we have multiple mother and child hospitals, which again provide total free of cost maternal and child care in the states of Uttarakhand, in the states of Jharkhand, in remote Vidarbha area of Yavatmal, and also here in Palwal, Haryana. And what is important to note is that we are very strong in the public health domain. I've always believed that tertiary care must go to primary if it has to improve ground level health care. We can't be sitting in four glamorous walls which are called super specialty hospitals and expect the national landscape of healthcare to improve. The tertiary care model must penetrate the ground into the primary healthcare system, and that is where the program of working with multiple state governments and strengthening public health at their grassroots level is an equally important task for Sanjeevani. So multiple programs are happening across the board in maternal and child health, and of course our core area of congenital heart. For instance, I'll give you an example. We have an endorsement and collaboration with the government of Jharkhand and Coal India to detect and screen congenital heart disease in the entire state of Jharkhand. Now, you would be aware that Jharkhand, Ranchi and Jamshedpur are very different. But when you go into the tribal Adivasi populations in the forested areas of Jharkhand, you see a very different landscape of our country. And to embark on these journeys and to do a complete statewide congenital heart screening, I think is a remarkable initiative, a combination of what governments, societal segments of corporates, as well as integrating partners like Sanjeevani are doing today to bring about a difference at the ground level. Also, we have forayed extensively into research and development. We have possibly the largest repository of heart tissue, of blood and serum samples also from our hospitals which do child heart care. So I've always believed that while we create temples of healing, they should also be temples of learning and research, so that the future should see a better outcome in terms of prevention of congenital heart diseases if you can. So research is again a vast new area that we have forayed into. We are a Department of Science and Technology, DST accredited research center, and research simultaneously happens in all our child heart centers. So this enables surgeons to also become scientists. Now this leads to new discoveries, new ways and models. And it is also my dream, Nandita, that India should also become a major healthcare manufacturing hub, because most of we use today in healthcare institutions are all imported, and that naturally adds up to the cost of healthcare delivery for the country. And it's very difficult for the common man to afford However good, laudable schemes of the government like the Ayushman Bharat and state schemes have done enormous good and contribution, but still it is inadequate because of the vast populations we have to serve. So I think research and development leading to innovation, incubation, and eventual manufacture is the next focal area which we are working with multiple state governments. So we are into genetics research, we are into whole body genome sequencing, as well as slow and steady penetration into medical equipment manufacture, beginning with certain small items that we use regularly in hospitals. So thereby, I would endorse the view of Viksit Bharat. A day should come by 2047 that much of what we use in hospitals should come out from India, so that we are able to bring costs and also bring out the fertility of the Indian mind and enterprise. We are such an enterprising nation because if we can only give form and shape and structure to some of this, I think the future is certainly going to be extremely bright, and that is going to be our foray. Of course, we have embarked on healthcare diplomacy. We serve a large number of troubled countries. Afghanistan was one of our very dear countries, but sadly, the political scenario changed there. But then we work in the African continent. We have requests from Cambodia, from Malaysia, and multiple countries in the South Pacific where we train, teach, and also skill develop. Also, finally, I'll sign off, Nandita, by starting skill development initiatives under the National Skill Development Program. We have multiple skill development centers to give young youth of our country, opportunities in the much needed healthcare skills. So these programs are again provided totally free of cost. So we get children from the hills in Uttarakhand and Himachal Pradesh down to the terrains of Vidarbha and Bastar, as I told you, and to rural interior Maharashtra, Jharkhand, and many such areas where opportunities are hard to get. So all in all, you see a very comprehensive model of addressing health and well-being. And finally, I would also tell you, Nandita, that I believe that hospitals are really institutions of transformation. You can truly make lives in hospitals, provided you approach it with that model of well-being and wellness. So we've started calling ourselves no more as hospitals, but institutions of wellness and well-being.
Great, great. So thank you so much, Dr. Sreenivas, for joining us today at Medical Dialogues. It was lovely to be understanding your journey, how it has grown, and what future holds for you. So it's definitely a remarkable one. And thank you so much for giving us all your insights on what commendable job work that you and your team are doing. So thank you once again.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.